Good afternoon. I'm Natasha Fullerton, a neuroradiologist from Glasgow, and I'm very excited to give you a brief overview today of a project for patients with motor neuron disease that we're really excited about. Just briefly to let you know, there is lots of people, a big team involved in this, a big team of clinical and scientific staff. But the main grant holders are myself, George Gorey, and David Porter. And I'll let you know about the rest of the team afterwards. So what we're looking about is we're looking to create very novel imaging for patients living with motor neuron disease to be able to find an earlier and better diagnosis. So I'm going to tell you quickly a little bit about the background, what our projects involve, and what we hope to achieve for patients with motor neuron disease, and how we hope this may contribute to future motor neuron disease research. So first of all, the background. You all obviously will be very familiar with motor neuron disease, but just a few points that are relevant for our project. MND is really a spectrum of illnesses, so-called neurodegenerative disorders, but it's not one single disease. There are lots of different subtypes within it. Some of these, a faulty gene has been identified, for others there hasn't. Motor neuron disease is characterized by losing nerve cells, the so-called motor neurons, which then ultimately cause that muscle weakness. And those nerve cells can be located in the area in your brain, the motor cortex, that controls all movements, or they can be located in your cord, in your spine. And there is, you will be familiar with different subtypes. For example, you may have heard about ALS and PLS. And these different subtypes can have quite different clinical courses, and because of that, can have a very variable impact on patients and relatives of those patients. And they have a different prognosis and require different management and different treatment, and potentially different novel treatments. Unfortunately, there are often still no specific tests to diagnose MND, and sometimes, as you may know from yourself or from loved ones, it can take quite a long time to reach a diagnosis. And there really is a need to improve that. We need to identify motor neuron disease earlier. We need to get a more personalised diagnosis for each patient, so there is a little bit of a prognosis and a more personalised treatment that can come with it. And we also want an earlier diagnosis so patients can enter clinical trials earlier. An earlier, better diagnosis is important because that can help make time count for patients and their families and friends. So as I said, we need that earlier and non-invasive diagnosis. And what we need is so-called imaging biomarkers. And imaging biomarkers are features on imaging that help us identify particular parts of motor neuron disease and subtypes that should be able to help us make a more personalized diagnosis for each individual. And within that project, we propose to identify those imaging biomarkers by using a very powerful MRI scanner, a 7 Tesla MRI scanner. And we hope to stratify patients into different disease subtypes, and we hope to establish a new Scottish diagnostic imaging protocol that is tailored and suitable for patients suffering with motor neuron disease. You probably will be familiar with MRI, but MRI is a magnetic resonance imaging. And what that is, it's a non-invasive imaging technique that uses magnetic fields and radio frequency waves rather than X-rays or radiation. And it gives us a three-dimensional picture of the region of your body we're looking at. in case of motor neuron disease, brain, and the spinal cord. And it can give us a lot more anatomical details of the different tissues within the brain that X-ray or CT scanner can't do. Now, a 7 Tesla MRI scanner is what we call an ultra-high field MRI, which is a particularly strong, powerful magnet that can give you even greater details of the inside of your brain. And to put that into comparison, most routine clinical MRI scanners across the country will be 1.5 Tesla. Tesla is the measurement of strength. And some of the more specialised neurocentres, like in the Queen Elizabeth Hospital, the INS, have a 3 Tesla scanner as well. So the 7 Tesla MRI I've been speaking about is located at the Imaging Centre of Excellence on the Queen Elizabeth University Hospital campus in Glasgow. If you look at this picture here, you can see the Queen Elizabeth Hospital, and you can see this space right next to it, which is where the institute is, the Neuro Institute, and where the ICE, where the 7 Tesla scanner is located and was built. And that scanner, here you can see that big magnet was put on in 2017. And a couple of years later, it got approved by FDA and it got CE certification in Europe, which means it is suitable and safe for clinical use. And it's really in a perfect location for any patient with a neurological condition, because you can see it's linked to the Neuro Institute. And in addition, in the Neuro Institute, we also have the clinical research facilities. So it's in a perfect place to facilitate both clinical and research use. And the scanner looks just like any other MRI scanner if you ever have been inside it. And if you look here at those images, this is just to show you an example of the different kind of things we can do with this MRI scanner and different ways we can look at our brain. We can look at connections, we can look at vessels, we can look at the function of the brain, we can look at the biochemical composition. So lots of different things we can do with this scanner, not just take normal images, but look at actual connections, functioning, composition. So how did we start with the 7 Tesla? Well, first of all, it took us a lot of time, a few years, to really get all the images to be of a good quality, to overcome all the technical difficulties, because, as I said, 7 Tesla is still quite novel. Then we went on to look at what advantages a 7 Tesla scanner could offer over the best possible clinical scanner, best possible routine clinical scanner, which currently is a 3 Tesla scanner. And we compared those, and certainly we found that 7 Tesla MRI gives us really exquisite details and high resolution of both the normal brain, but also a brain suffering from neurological conditions. And one patient group we scanned to see if there could be a potential benefit were patients with motor neuron disease. So far all good. I've told you why 7 Tesla MRI scanner could be really promising for patients with motor neuron disease. However, it comes with some challenges as well. And apologies, there's a lot of physics on this slide. I tried to simplify it, but it's just to try and explain to you the challenges and how they're relevant for this project. So if you look at MRI scanners, the higher your magnetic field becomes, and 7 Tesla is obviously higher than 1.5 and 3 Tesla, the shorter that wavelength that the scanner sends out that goes through a patient's brain and then goes back to the scanner to create the images becomes. And at 7 Tesla, that wavelength is about 11 centimetre, which is actually a little bit less than your average brain diameter. So what happens? You get excellent images of this part of the brain here, where your motor cortex sits, the area that I said controls your movements and that usually is affected in motor neuron disease. But you often get less good images of the lower part of your brain and your upper cord because you lose some signal. If you look here, you can see that area that's a little bit darker. Oh, this is really relevant because motor neuron disease can affect and affects that lower brain, your brainstem here, and spine, in particular in some subgroups of the subtype of the disease. And we really need to be able to not just look at that area, but also this area for patients with different subtypes of motor neuron disease. So how can we fix that problem and see the lower brain, that brainstem, upper cord or upper spine better, and the connections obviously that run from the higher part of the brain to the lower brain? We can do that by using a very innovative, unique, novel coil, the Glasgow head and neck coil. A coil is like the antenna of an MRI scan. It's like a plastic football type helmet which lies inside the scanner, and that is where your head would rest if you're lying inside the scanner. This coil is vital for the scanner because that's what receives those radio frequency waves and what sends them back to the scanner to create images. Now, we're really lucky. We've got excellent coil engineers in Glasgow working with us who were internationally renowned and have very, very unique expertise, which is Sajan Gunamoni and Divya Bhaskaran. And they've created a special new coil which can see the lower part of the brain and the cord better. And here are some images which are going to be shortly published. And you can see, looking at that, how far down you can now see into the spine, and that you get really good images of that lower part as well of the brain. So this is really promising for use in patients with some subtype of motor neuron disease. And to just tell you what our project involves and then why this is relevant, just some pictures of some of the team, and there are many others not in the photo. But here you can see Divya, who I just mentioned, who now is off a maternity leave. She's just had a wee girl a couple of weeks ago. And Sajan, our coil engineer, here's myself, here's David Porter, the professor of MR physics who is responsible for the 7 Tesla scanner. And here is George Gore, one of our neurologists with a particular expertise and interest in motor neuron disease. So in our proposed project and study, first of all, what we're currently doing, we are just making the images as perfect as they can be with lots of new techniques in healthy volunteers to make sure for the patients going in that everything is optimized. Then we're hoping to, within the next month or two, to start the actual patient study as soon as we're happy with all the analysis and outline and optimization of the images. And this will be a pilot study, which means we're hoping to use that data to inform larger studies afterwards. And we're going to scan 20 to 30 patients with MND, at this stage with known MND, in the 7 Tesla scanner. And that will include with patients with different subtypes of the disease, some with known genetic mutations, and they will be recruited by our neurology team led by George Gore, and it will involve for the patients 2 visits to the 7 Tesla scanner at 6 months interval, because we're looking to see if there is a change over that 6 months interval. And at the same time, we'll be asking patients just to fill in some questionnaires which are just capturing the experience in the scanner, if it was comfortable, and B, just the general functioning, day-to-day functioning of living with motor neuron disease, because we want to correlate that with the scans as well. And these patients will be randomized in two groups depending on which subtype we're suspecting they have, or if the clinical presentation indicates it's more the upper part of their brain or the lower part and the spinal cord also affected. For those where they appear to be predominantly have the upper part of the brain affected, we're going to use a commercially available coil, the antenna. And this part of the study is funded by my name's Dory Foundation. And for the second group, we're going to use that special coil that I mentioned to you, that I've shown you the pictures designed by Divya and Sajan, as part of our Neuroscience Foundation grant, which is our big word neurovascular head and neck coil, which we're really excited about because this is really very novel, and the coil is very unique. And this is supported by Motor Neuron Disease Scotland, by MND Scotland. And we're very excited about what we hopefully can offer patients with that. We'll correlate the data with the disease and genetic subtype, as I said, the functioning, the questionnaire with that. So moving on, just to show you the imaging biomarkers that I mentioned, the specific features and parameters that we hope to assess. These are based on hypotheses we derived from the literature, from the clinical experience the motor neuron disease team has, from patients, from our radiological experience with motor neuron disease imaging, from the knowledge about the pathophysiology, the underlying processes causing motor neuron disease, and obviously our experience with those earlier first motor neuron disease scanning at 7 Tesla we had. And what we are looking at is we're first of all looking at that motor cortex, which I mentioned controls your movement. And what happens in motor neuron disease, the neurons, nerve cells degenerate and eventually die. And what happens is they leave behind minerals and iron. And that can be assessed on MRI because it can leave a so-called motor band sign. Then also that degeneration of the nerve cells can lead to changes in the chemical composition of the brain at that level. And MRI scan, and in particularly 7 Tesla, is excellent, far superior to other MRI scanners, is we can non-invasively do sampling of the brain to look at your chemical composition. And we can look at some specific metabolites, chemical components present, which may indicate us the underlying mechanism that may have been responsible in that patient for motor neuron disease. Then, as I mentioned, MND affects obviously the tracts that go right from the top of your brain down into your cord, the connections. So we'll look at these as well and see how they differ in patients with motor neuron disease from patients not suffering from the disease, how they differ in patients where one side of the body is predominantly affected compared to the side that is less affected. In addition, we're doing a very complex analysis of the fluid system in a brain, which removes waste products, because there is evidence that if that system is faulty, people may be more likely to develop motor neuron disease. It's shown to be related to some other neurodegenerative processes, for example, some dementias. It is shown to not function well in some patients after a head trauma. So we're looking at how much that plays a role and if that can be used to diagnose motor neuron disease or identify possibly differences in different patients. We're looking just to see, do we get a different signal back and different areas of the brain, in particular in earlier stages of motor neuron disease that may indicate inflammation. And also what we're going to look at is just the volume of the brain and different parts. For example, it's known that some patients with motor neuron disease may have some issues with the part of their brain, their frontal lobes, which slowly stop functioning as well as they should. So we're looking at any changes in volumes that could indicate that a particular patient may be at risk of this. So here, I'm going to show you some images that we've obtained on 7 Tesla in patients with motor neuron disease, just to tell you those things I've just talked about, what they actually look like on a scanner, and to then show you how superior that 7 Tesla scanner is compared to the lower field strength scanner. So you hopefully can see the exciting opportunities these may offer for motor neuron disease patients and future research. So this area here, where you can see the blue arrows, is that motor cortex I mentioned, which controls movement. That motor cortex, if you look here, this is a particular MR technique which looks at blood vessels and it looks at minerals and iron. And you can see that sort of subtle dark rim. And this is that motor band, which shows you we've got neurons here which are degenerating, which no longer function normally, and they leave that mineral behind. Here's a different technique to look at it. You can see that darker area. This shows us the diseased motor cortex in a patient living with motor neuron disease. This is the technique I mentioned, which is that non-invasive sampling of the composition of the brain. And 7 Tesla is particularly good at this because it shows you us the individual components in much greater detail. And we're looking to identify these peaks, which indicate all different chemicals. And we're hoping to identify specific ones which indicate motor neuron disease or different subtypes. And if you look at that, that was from our professional analysis of patients we've done suffering from motor neuron disease and patients, healthy patients suffering from no known neurodegenerative disorder. And you can see there is differences already that we're seeing. We're currently optimizing that technique further to in particular identify some markers that we know are very specific for some subtypes of motor neuron disease, like the glutathione I mentioned. And we've got great physicists who are able to do this. And it may sound easy, but it involves a lot of complicated work to try and better see those relevant chemicals. This is an example of those tracts I mentioned that we speculate are affected in motor neuron disease, and it's the corticospinal tract, which is what links that motor cortex all the way down to your lower brain and your cord. And you can see in blue is the fibers. This is an example on 7 Tesla in a patient, in a healthy patient. Here again, you can see these in blue. And we're planning very detailed analysis of the volume of connections of this. And this is a technique which quantifies that mineral. And this is an analysis done as part of this project. And it's just to show you what appearances look like. And we can then get in more detail a very objective measure of how much minerals we have in the motor cortex, but also along that corticospinal tract. Some of the changes I mentioned we're going to look at is that early inflammation we're seeing in some patients with motor neuron disease. And this is actually a patient on diagnosis at 3 Tesla a few years ago. And you can see here that where the arrows are, that this looks a bit brighter than the rest adjacent to it. Again, here you can see these bright lines, and this implicates that tract, corticospinal tract, is full of water, which means it's inflamed. There is some edema in it, and that is something which we can occasionally see on a routine diagnostic 3 Tesla scan in patients with motor neuron disease. Now, of great interest was this was a patient with a more benign subtype, and when we scanned this patient at 7 Tesla and a repeat 3 Tesla scan, I think it was about 5 years after this scan, this had disappeared. And which I think is an interesting finding, because it may be that this shows us how changes happen over time in the brain of a patient living with motor neuron disease, and it may help us to get an indication at what stage of disease the patient is in. So this is the same patient, as I said, a few years later, scanned on 7 Tesla. And you can see here again, this is the technique which shows us minerals. You can see where the arrow is. This is the area in the motor cortex which controls the hand movements. And you can see this patient very specifically has that mineral deposition overlying the area that controls his hand movement. And here you can see it actually goes further down all along the tract. And it nicely seems to correlate in the preliminary patients with the area most affected, hand, feet, and also with the side that is more affected. This is just to show you the comparison, and that, apologies, that was a healthy volunteer. This is to show you the comparison of the imaging obtained in the same individual with the standard Nova coil. And actually that is somebody where we got pretty good images in the Nova coil, and in that very unique head and neck coil, which part of our study involves, that we're very excited about. And you can see, look, you can look down to right to the bottom of your cervical spine, your neck spine and cord, and you can get lovely details of that brain stem. So this is really exciting for imaging those patients who we think suffer from subtypes of motor neuron disease that have a greater effect on the brain stem, the area that controls a lot of your speech, swallowing, and your cord, which is highly involved with movement as well. And back again to that patient we've just looked at that I mentioned to you. Now, this is the 3 Tesla scan performed at the same time as that 7 Tesla scan. And if you look at that, you know, on 3 Tesla here, 7 Tesla here, even with the eye of hindsight, that's the motor cortex. You can see, I see it in a lot less detail. I can't identify that motor band sign, that mineral deposition. Look at the 7 Tesla, just so you've got it again as comparison. You can beautifully see that motor cortex, can't you? That mineral deposition over that hand area. So it shows us that we may have been missing a lot on routine clinical scans, because you just can't see it. Imaging features which can help to diagnose motor neuron disease, and it shows us that great potential that we could use that potentially for a faster, more individualized diagnosis. Here again, a different patient, and this patient was scanned, a presentation on a 3 Tesla scan, and 7, sorry, it says 2, that's meant to be a 7 Tesla scan, 6 years later. So you see, this patient, if we look back at presentation, this is again the motor cortex, this is the hand area, here is the foot area, the area that controls. But if we look particularly at the hand area here, 6 years later, you can see that's a lot slimmer, isn't it? We've lost a lot of volume. It shows us how many neurons have really been lost in that time period. And 7 Tesla, because it gives you such good anatomical detail, will be able to calculate volumes much better and see it. And here again, another motor neuron disease patient, you can see how much volume has been lost there. So again, something we're going to look at. And just again, another technique to look at that degeneration of that motor cortex, 7 Tesla here. You see that dark band. That again are these neurons which sadly are no longer functioning well or have died and become degenerate. That is that motor band sign on a different imaging technique at 7 Tesla. On 3 Tesla again, your guess is as good as mine. I think even knowing what we see on the 7 Tesla, you would be pushed seeing it on the 3 Tesla or identifying it with any confidence. So you can see that it's big promise here. And that again, 3 Tesla, 7 Tesla, that patient, I've just shown you the different imaging. And again, just to show you, I can see here that mineral deposition affecting the area that controls the patient's hand movement, and it's starting to go into the area which controls face movement as well. And I just cannot see that. And that is a high end of the range, a very good specialized 3 Tesla scanner, which is better than most clinical MI scanners. So you can see the big difference here. So what do we hope to achieve for patients living with motor neuron disease? Well, we hope an individualized 7 Tesla MI imaging protocol, which would help to give a fast, non-invasive and a personalized diagnosis, because we think it's really important to have a diagnosis not just of motor neuron disease, but indications of possible subtypes, which will give an indication of prognosis as well. And I think it is really important, the earlier we can diagnose somebody, the more time they have to enjoy with their family and friends. And not just that, it gives time to give them treatment earlier. So it's a very novel imaging approach, and we hope that that can form the basis for future motor neuron disease imaging, but also a biomarker database for Scotland, where we can possibly then use AI techniques, which then will give us a bigger picture of different mechanisms causing the disease, different patterns that can then be used to help guide and develop treatment. As I said, we want to stratify patient groups so we can facilitate that patients get an earlier personalized treatment. And I think that's very important. We've heard about lots of exciting studies like MND SMART, which promising treatments that hopefully will come out over the next few years. And I think if we can get patients into trials earlier because we've got a diagnosis, and if we can monitor their progression in trials better as well, see is the treatment objectively also slowing down the disease. Obviously, it's very relevant how the patient feels, but it's good to assess the validity of a treatment to also get an objective idea. And of course, so as we said, we want to monitor and quantify that progression of disease in individual patients. So I think it could be a really important and exciting tools that we could combine with other trials as well. And it hopefully will give us more insight into mechanisms causing motor neuron disease, and Possibly it will help to also contribute to establish a bigger pan-Scottish motor neuron disease research centre in the west of Scotland for patients. And we have to remember that 7 Tesla scan is a pan-Scottish resource, so hopefully something that could help a lot of patients. So first of all, I want to acknowledge all of our brilliant team that have contributed. First of all, the specific or more specific motor neuron disease research teams, which involves staff in the University of Glasgow MI physics group who are all contributing a lot with the techniques and analysis. Our videographers, research videographers who, if you'll ever meet them, are absolutely lovely. And as I said, our very highly specialised coil engineers who are internationally renowned, like Sargent is building coils for Paris, for the United States, for lots of different places. And of course the MND neurology team. But also just to acknowledge the wider 7 Tesla research team at ICE, who all have contributed a lot to the safety of the scanner and of the coils, to general ICE research, to collaborations with the manufacturer of the scanner, and also to that 3 Tesla, 7 Tesla comparison study I mentioned. But importantly, a massive thank you to our grant funders, MND Scotland, who I said is helping us with the arm that will use the novel, very innovative coil, and to my name's Dodie for the other arm of the study, and of course all the fundraisers. And very importantly too, a big thank you to patients and healthy volunteers who are helping us to develop that tailor-made imaging and imaging approaches to MND, and we're really grateful for them giving up their valuable time in participating in both healthy volunteers and patient scans. So a big thank you to them. So thank you very much to MND Scotland and my name's Dodie for giving us the opportunity to hopefully contribute to MND research and hopefully help to improve diagnosis and therefore quality of life for patients living with motor neuron disease, and to contribute to future research. Thank you very much.